Hi, everybody. Good evening. It's almost that time of the year. Holiday season has begun, so I really want to thank all of you for showing up here for this very important topic, and also to those of you who are signing in and watching us live stream this. Thank you for joining. Really appreciate it. So tonight we have a really special program and a really special topic. As you all know, CURE is all about advancing healthcare and advancing cure. But none of that would actually be possible if we were not able to make healthcare accessible to all. And I think healthcare disparities and racial barriers are something that we have become even more aware of and attuned to these days. And it's always been there. But now the conversation has begun. And so we want to address this important topic today. And joining me today are going to be two very special guests, Dr. Uché Blackstock, a good friend and a previous collaborator. Thank you so much. And she is a physician in emergency medicine, but also the CEO of Advancing Health Equity. And we have Dr. Julius Johnson, who is actually a primary care nurse practitioner. And he actually is also somebody who is the co-founder or founder and president of the Black Nurses Association here in the greater New York City. So he will share some of his experiences from the front lines, and Uché will talk a little bit about what it means at the systemic level to be talking about this topic. And we're bringing this to you today in collaboration with our partner and co-sponsor, the Aspen Institute, Science and Society. And I would like to welcome Aaron Mertz, who is a director, to say a few words about this program. Come on up.
Thank you, Seema, and thank you everyone for coming today. I'm the director of the Aspen Institute Science and Society program, and we were born about 4 years ago, and we have the broad mission to help elevate science for the public good. And we work principally across 3 pillars. They are public trust in science, science and social justice, and global science. And so this event will very likely transcend all of those, but we're really excited about the social justice component. And we have known Seema since the very beginning. She has, through her involvement at the Broad and at MIT and at Johnson & Johnson, and she's on our advisory council, helping us steer toward the most important activities that we can. And I just want to make a quick plug for one of our newest projects. It's called Discover Discovery. I would welcome all of you to participate. We're seeking stories from people in science and science-adjacent careers to tell us when you discovered the act of discovery. And just a 60-second video that will be on our website and social media. And we're hoping to inspire the next generation of scientists to show them that those early moments of inspiration could actually fuel long and productive careers. So thank you for coming today, and thrilled to partner with CURE. And back to Seema.
Thank you. Thanks, Aaron. All right, so I'm going to, without further ado, welcome up Uché and Julius. Come on up. Please have a seat. Welcome to CURE.
Thank you.
Hope you both got a tour of the facility. Yes. What do you think?
Very impressive.
Very impressive, yes. And it's actually the vision of the founder, Jim Flynn, who's sitting over there. Hi, Jim. Great for you to be here. Thank you. So I thought maybe we would start by talking a little bit about yourself, how you got to be where you are and your background. So Uché, you started off at Harvard studying medicine, and then you decided at some point to just leave all that and start this in 2019. Right. So we're gonna start with you telling us a little bit about your journey, going back all the way to your childhood and where you are today. And I'm gonna do the same thing with you as well, Julius. Okay, so Uché.
Well, before I start, I was going to say thank you, Seema, for inviting me. We worked together on another collaboration. I'm technically on vacation, but she asked, but Seema didn't know this. She didn't know this, but if she asked me to do anything, I can't say no. So I'm here. No, I'm here, and I'm so excited about being here. But that means something about who Seema is and what she represents. So I have to always start from the beginning because I think a lot of what shapes, our lives is where we began.
Yes.
And so I always tell people, so I am the second generation. I'm the daughter of a physician, of a Black woman physician, which is something that is actually very rare to say. So my mother was the original Dr. Blackstock.
Yeah.
And she was born in Brooklyn, New York, probably about 15 minutes from where I currently live, to a single mom. She had 5 other siblings, and she was raised in poverty on public assistance. And she was the first person in her family to go to college, to graduate from Brooklyn College. And at Brooklyn College, she had a chemistry professor who saw her potential and saw her light and saw her work ethic.
Nice.
And encouraged her to apply to medical school. And it was something that she had never really considered, because she had mentioned it once to her junior high school teacher, and her junior high school teacher said, no, I think you'd be better doing something else. Wow. So she was discouraged. And so she ended up applying to medical school and got into all of her medical schools and ended up matriculating at Harvard Medical School.
Yes.
And as you can imagine, she felt like a fish out of water there. But she found her people there, and she ended up graduating, doing well, but came back to New York City to train at Harlem Hospital, and then ended up working in this very same neighborhood that she grew up in.
Nice.
And that really meant so much to, I have a twin sister, to my twin sister and me. I grew up thinking that actually most physicians were Black women, because my mother was the president of the local Black women's physician organization. And so she would take us to these meetings. And so it wasn't until I got older that I didn't realize that wasn't the case.
Yes.
So that was my normal growing up. But my mother, again, practiced in the very same neighborhood that she grew up in, taking care of her neighbors. She practiced academic medicine at Kings County and SUNY Downstate in Brooklyn, and mentored junior faculty and medical students, performed academic research, organized community health fairs. Mm-hmm. Basically, my mom was working to advance health equity when health equity wasn't an expression, exactly, when it wasn't like a sexy term. People didn't know what it was, but she was doing it. She was doing diabetes screenings, high blood pressure screenings with her colleagues. And so she was obviously a huge inspiration for my twin sister and me. We both are physicians now. And when we were in college, when we were sophomores in college, she was diagnosed with acute myelogenous leukemia at the age of 46. And she lived for about 9 months and underwent very rough chemotherapy treatments.
Sorry to hear that, yeah.
And we lost her after our sophomore year. But as you can see, she's been an incredible inspiration in a lot of the work that I do. And I'll talk more about this with advancing health equity is because of the legacy that my mother has left and wanting to continue her legacy. So that's my inspiration for being here today and doing the work that I do.
She continues to live on through the work that you do.
Oh, absolutely,
right? Yes.
absolutely.
That's great. You, Julius, talk a little bit about you. So, first of all, male nurses are few and far between. Black male nurses, fewer and farther in between. Tell us about your story. I mean, why did you decide to be a nurse? I mean, was there an aha moment? And where did you grow up? Right here, right?
So first, thank you for having me. This
Yes.
is an amazing space. I can't even wait to see what y'all do once y'all are fully operational. So I'm from Brownsville, Brooklyn, New York. I'm a Brooklyn kid through and through. I went to a school called Claire Barton for health professions, and they focus on introducing high school students to various health professions. Like I said, families from Brownsville, and my dad's a nurse. But my dad became a nurse because my grandfather was shot in 1983. He was a transformational business leader in Brownsville. And he was shot while he was dying. My dad went to his bedside. There was a male nurse named Henry that my dad grew up with. And he hadn't seen Henry in like 6 years. And now he sees Henry, and Henry's a nurse. And he's like, what is that? Right? Like, because in my dad's eyes, men can't become nurses because he had never seen one. Dad eventually, after my grandfather died, my father was discharged from the Army. He moved up to Connecticut because he didn't want to come back to New York. Eventually, he found nursing. And I went to go see him one day, and I was at the nurse's station. And this nurse comes in, and she yells, "Thumper, thumper." And all of the nurses in the nurse's stations get up and take off. Now, where I'm from in Brooklyn, if you are with a group of people and one person starts running,
Right.
we all gonna start running, right? So, true to story,
Yeah.
as they started running, I got up and just instantly started running with them. We end up in a patient room.
Yeah.
They're doing CPR, they're hanging things, and I'm just amazed. And I'm like, this is amazing.
Yeah.
And I have this adrenaline rush, and I know they're helping people, right? I know they're helping this person. And we get out, and I tell my dad, I'm like, Dad, you know, because at first I wanted to, I saw a movie called Backdraft.
Yeah.
So I wanted to be a firefighter and run into burning buildings. Then I grew up during the HIV epidemic that was sweeping through the Black community, and I knew it was something terrible, and I wanted to be a doctor that found a cure.
Yeah.
After that, with my dad, I'm like, I need to do exactly what you do. Whatever it is that you did, tell me step by step so I can get here. I eventually went to Binghamton University, and I came out, I graduated, I started working at NYU doing critical care, doing exactly what my dad did, and it took me all of 13 months to realize I am not working in a hospital. I did not like...
Why was that?
So I realized quickly that I didn't like doing things just because somebody said you have to do them, right? Like if this said this family member wants this treatment or this family member wants to refuse this treatment. It was just, this is the standard, we are all doing things this way, especially at the time during the hospitals back in 2005. And at Binghamton, it was the first time I realized I was a minority. Because growing up in Brooklyn, everybody looks like me. The only time we saw people that didn't look like us is when we came to 42nd Street on Easter. So now I go to Binghamton and I'm like, oh, this is what they meant by being a minority. Right now,
Yeah.
population of Black students at Binghamton is 3.5%.
Yeah.
And I'm sitting there in this big lecture room and I'm like, oh, there's nobody that looks like me.
Yeah.
So I realized that I didn't want to do that, but while I was in undergrad, they told us about nurse practitioners. So I was like, you know what? I'm gonna go back to school and do that. And it was like, you can own your own business being a nurse practitioner, you can own your own clinic. It's like, I'm definitely gonna do that. I went back to school, became a nurse practitioner. I came back in 2009, going to 2010, which was an economic downturn for the country, but house calls were starting. So I got involved in house calls. That was amazing. I got to create a difference in the communities I grew up in. I was literally going into neighborhoods of family member houses that they saw me and they're like, you look familiar. And I'm like, well, my family is the Bernards and the Johnsons. Like, we know you, we remember you. And now I was sitting there making a difference. I left there and I decided I wanted to do more systemic things. I wanted to create sustainable change. And went and got my doctorate from the University of Miami, and there they showed me how to put all my gifts to use and say, okay, you know how to work within a system. We're gonna show you how to run a system. We're gonna show you how to forge collaborations. We're gonna show you how to create sustainability. That's how I got here.
Wow. What a great book. Great stories. Excellent stories. So, Uché, you and I have known each other for such a long time, but we've never met in person. First time we're meeting in person, because when we first met, we were on Zoom because we were in the throes of the COVID pandemic, right? And this is before the vaccines and everything. Right. And many companies were trying to recruit patients, you know, from communities of color for the vaccine trials, and had a very hard time because the trust was so low. Talk a little bit about that. I mean, this is, you know, first we had the pandemic, then you had George Floyd, so it was a twin pandemic. Right. So so talk a little bit about that and why it was so hard and why is trust so hard?
Yeah, so I'm gonna like back up just a little bit because I didn't add that I was in academic medicine for 10 years at an academic institution here in New York City, and I kind of just had an awakening in that role that I could do more just working outside of an institution with my own company, because the goal really is to create diverse, inclusive workplaces so that, especially within healthcare, so that we can care for our patients better, right, and provide equitable care. And so I started advancing health equity in March of 2019, right? So it's like I had this vision.
You left medical practice and decided to do that.
So I was working part-time in urgent care, and people thought I was crazy. They're like, you're associate professor.
Yes.
You know, you have all these titles and you're leaving. And I'm like, no, I just see things are really bad. I'm seeing these racial health inequities that, are harming people in my community, my family members, and it's very upsetting. I have to do something about it.
Yes.
And no one in academic medicine, you don't leave to become an entrepreneur.
Yes.
Yes. That is very rare.
Yes.
Because I think
especially a Harvard-trained, physician
Right.
is not going to leave it all
yeah,
behind.
I called my dad and told him, and he said, "Wait, what are you doing?" And I said, "Wait, I thought you were the one
Have
that
you lost
said."
your mind?
I know.
Yes.
I said, "I thought you were the one that said working for yourself is the best thing to do." But wait, now I'm saying I want to work for myself, and you're saying no. And I think he was just being a father, and just being protective. But yes, so what was interesting is, so then I was transitioned into urgent care part-time and then working with Advancing Health Equity, which is a health equity consultancy that I founded. But in those first few months of 2020, everything was great. I was doing this clinical work, and then March hits, and I turn to our staff in the urgent care and I say, "Do you recognize that all our patients look like us?" Because at the time I was practicing in a very diverse area of Brooklyn that was rapidly gentrifying. And so we saw everybody. We saw Black folks who had been in the neighborhood for decades. We saw new white families with kids. So we saw everyone. But what became obvious in those first few weeks of the pandemic was that we saw mostly Black and brown patients who were essential workers and service workers who couldn't work remotely.
Yes.
And then the staff were like, "Yeah, everyone literally looks like us."
Yeah.
And so I actually started writing about it. I wrote an op-ed, and I wrote one of the first perspective pieces in the pandemic about what I feared this virus was going to do, and that
disproportionately affecting
the disproportionate impact.
Yeah.
And I actually sent it to a bunch of publications. I sent it to Slate, and they said, "Actually, can we interview you? We want to actually learn more about what you're thinking may happen." Yeah. And so that kind of started things, and so I was able to use my voice. So even though things kind of went sideways in that March, I was still able to write and to amplify these issues that I care so deeply about. Yeah. And then Mr. George Floyd was murdered, and it really just pulled back and exposed everything that we knew and that I had known, the reason why I founded Advancing Health Equity.
Yes.
But one of the things, as you bring up, is this issue of trust.
Yes.
And one thing that I like to say is that I like to kind of turn it on itself. So I like to say that people may mistrust institutions, but institutions have not proven themselves trustworthy, right? And so people bring up Tuskegee a lot, which I think is fine to bring up, but I think we need to recognize that there's ongoing discrimination and bias that happens current day in the healthcare system. And it can happen on an interpersonal level when you're interacting with a healthcare professional, when we have data that shows, especially, for example, the Black maternal mortality crisis. A piece of that is that Black, pregnant people are not being listened to, or their complaints are being minimized.
Yes.
And so that is impacting the care that they receive when they present to hospitals complaining of pelvic pain or complaining of bleeding.
And it could even happen to a famous person like
Serena Williams. Like I think that is just her story is so powerful because it shows that even someone who has the resources, someone that is well known, someone who is a world-class athlete who knows their body well, right?
Yep.
She has all those things going for her, right? That you would think that the staff would listen to her, and she told them, "I need an ultrasound of my leg because I've had these symptoms before. I think I have a blood clot." And unfortunately, by the time that she got the study, it had embolized, so it had moved from her legs to her lungs, and she was having symptoms. So I think that so this issue of institutional untrustworthiness, I think is something that we really need to work in focus on, because it's really about gaining the trust of the communities that are served by organizations and institutions. And so we can talk a little bit more about how you do that, but part of that is centering community voices, partnering with community-based organizations. It is not rocket science.
Yes. And speaking about community-based organizations, I mean, that's what you do, right? On a daily basis. You are doing community care in the community. And at one point, you actually were working as part of the barbershop, project, where, okay, so let's go to where people gather and where people are in an area where they can trust each other, and let's go to health education there, right? Talk a little bit about that project and why it worked, and how trust was used in a positive way to administer care.
Absolutely. So before we even get to the barbershop, and just bridging us from what Dr. Uché was saying into the barbershop, the trust part is important because people they didn't wake up and mistrust the system. They were treated this way. They had family members that passed down stories. And to know the history of African Americans in this country is to understand that we pass down a lot through stories.
Yes.
From slavery all the way through now.
Oral history.
That holds a lot of weight to us. And before we even got to the barbershop talks, we was having, let's just have men's meeting. Because as black men, we need to have better health care. Part of that starts with ourselves and being the leaders of black healthcare professionals and talking to other black men. Another part of that is our resume and what we've done. So, for example, the Black maternal child health crisis. One of the things we did was, all right, we have to start a Black maternal conference. And I knew that as a black man and president of the Greater New York City Black Nursing Association, I had to step up.
Yeah.
Because sometimes when there's an issue, it's not the people that's having an issue that needs to step up, it's the other people. So as a black man, I had been completely ignorant to this side until I had a child, right? And it was a difficult childbirth. And then my sister had her second child later, and he was born at 24 weeks. And then I had two fraternity brothers who lost their daughters to childbirth. And at this point, I'm like, oh, there's an issue. And sometimes when you're looking around for the leader, it's in the mirror,
Yeah.
right? Because when it first happened, I'm like, who's gonna say something?
Yes.
And eventually I was like, oh, that's supposed to be me.
Yeah.
And then the first barbershop talk was, first really men's bow tie virtual event was during COVID because we had to do something. We was talking about, it was a rise in violence during COVID. How do we talk about this as men? Let's get together, let's have breakfast virtually with people from New York to California and have this conversation. A lot of that stemmed from, because moving to virtual space was very difficult for a lot of people.
Yeah.
We have to find ways to navigate that. And then eventually we start opening back up. We ran vaccine clinics. We did all of this work. Okay, let's go back into barbershop. So now when we get to the barbershop, we have a resume of, we taught you about what a vaccine trial looks like. We brought vaccine companies to talk with you directly so you can ask conversations. We've done Black maternal health. We've done these other events. And now that we're here in the barbershop and we can talk to you, you're like, oh, you're from me, you're one of us, and I can trust you because you have a resume, which was very important.
Yeah.
Go ahead.
Yeah.
As you're talking and thinking about all these other things, no, keep going.
So we started having the barbershop talks because we needed to have conversations surrounding, are you gonna get vaccinated? Because like Dr. Uché said, it was a great joke at first that black people don't get COVID. That was the running joke. Oh, we don't get COVID, you don't have to worry about it. Then the world shut down. And then the numbers came out, and it was like, there's a lot of us that's on this list that are dying. Yeah. And it's like, no, we're disproportionately being affected by this. So as we started having those talks, I remember one barbershop talk, we had the conversation, it flowed, it was going great. When we finished, the barber said, yo, I'm gonna challenge you. So it's myself, it's a physician from Stony Brook, and then it's another good friend of mine that's a nurse. He's like, let's go outside right now and see if we could talk to the black men in this neighborhood and just change their mind about the COVID vaccine. Let's do it. We step outside and we just talking to people on the street as we're walking, talking, having conversation. But a big part of it to them was, I'm not doing it because I don't trust it. I was like, okay, I'm not forcing you. But as we started having a conversation, then they also asked, well, are you doing it? And if you're doing it, then why? And we realized that if we are doing it, if we're doing what we're asking people to do, they trust us because they see us as leaders. They also see us at that point as, I like to say, I don't want to be a hero, I want to be a window. Meaning I want you to see the way out of your situation. I don't need to come save you, I just need to open a pathway for you. And they started seeing us and viewing us as that because for black men, the barbershop, it's our most sacred place. Yeah. We go there to have conversation. We go there for marriage counseling. we go there for regular therapy. We go there for job interview skills, right? Like we go there for everything in a barbershop, which is why if some of you are married and you're significant other goes to the barbershop, they may not come home for 5 hours. Right? So it was a good way to
Even though
leverage
they
it.
may just have a few strands of hair,
Yes.
still,
Yes.
it's a psychiatrist's chair to some degree. Yes.
No, but
So,
I
yes,
was going to say, no, there were two things that I was thinking about, but my own barber, so in the 2000s, I used to wear my hair really, really short, like shorter than yours. And so one of my barbers, I still see him in my neighborhood on the main drag all the time. And it was December of last year. And I hear someone call my name. I hear, yo, Uché, and I turn around and it's G. And he's in his car and he gets out of his car and he gives me this warm bear hug that he always gives me. And he says, I need to talk to you. So I said, about what? And he said, about the vaccine. And this is about a year after the vaccine's been out for a while. And so I said, okay, of course. I said, just give me a call next week. And the following week we spoke for about an hour and his adult daughter was on the call with me. And they asked the most thoughtful questions. But what he said to me was, Uché, I don't have health insurance. He says, you are really the only doctor I know and you're the only doctor I trust.
Wow.
Yeah, and 3 weeks later, he got vaccinated.
Wow.
So that's why I always, and I think to myself, like, what if everyone had a Dr. Uché? Not necessarily even just me, but but what if everyone had access to someone?
So how do you do that? I mean, how do we do that, like, not as a one-off, but
I
systematically?
know. Well, I mean,
right?
there are multiple issues. He doesn't have health insurance, right?
Yes.
So I truly am a firm believer everyone should have access to health insurance and affordable health insurance, and then also too that we need trusted messengers. We need people in the community that people can relate to, and he actually told me, he says, I know because also you got your kids vaccinated. He said, that's how I know that, you trust these vaccines.
Yes.
But I also think the other piece of it, and we talked about this before, is that, I think everyone probably has their own opinion about this, but one of the reasons for mistrust is because our communities have been so neglected for so long and disinvested in, right? And so I know a lot of people said, wait, so you weren't thinking about us before and now you want me to take this vaccine?
Yes.
And I'm like, you're not wrong. Like, but that's what the optics look like.
Yep.
And that's why I think that, obviously it can't be like a one and done, like we're going to try to push this vaccine on you because that's what it looks like. And that's why I actually was very, very patient with a lot of people.
Yes.
People in my family, people in my community, because
It shouldn't be push, it should be a pull.
I got it. I understood it. Although I have I'm also a physician, so I
Yes,
understand the science and I appreciate the science, and I'm amazed by the science and
Yes.
grateful for it.
Yes.
But at the same time, it's like our communities. You've been ignoring our communities, right?
Yes.
And now you're trying to push this on us.
Yes.
Like that doesn't make sense.
Yep.
And that's why I also think a really holistic approach needs to be made. So it's not just about vaccines, but in the pandemic and still ongoing, we think about like paid sick leave, making sure that people have paid family leave, making sure that people have access to healthcare.
Yeah.
Like all of those are really, or to gainful employment, to housing,
Yep.
like, all of we call it social determinants of health.
Yes,
That's very
exactly.
important.
Because the social determinants of health, I mean, that's, because the zip code where you live shouldn't actually determine the outcome that you have if you go to the hospital, right?
Right.
And how do we change that? Because right now you could be in one zip code over here and just 2 towns over this way, your outcome for the same thing could be completely different.
Right, and your life expectancy could be
Can
different,
be
by almost 20 years.
Almost 20 years, yes, exactly.
Based on what community you live in.
Yeah. So how I mean, you've done some of this work at the community level, right?
Absolutely.
And you've seen some best practices and things work.
So from my experience, what has worked is you have to have trusted community partners, and I know it's one of the most favorite cliche lines now, right? Oh, a trusted community partner, and sometimes we think that's just somebody that looks like them that is somewhere posted up in their neighborhood. But it has to be somebody that's actually, or organization that's actually doing the work.
Yes.
And then you have the funding that comes in.
Yeah.
And when I talk to funders, I often tell them there are most people who get the funding are people who know how to write the grants, right?
Yep.
And I'm not mad that they know how to write the grants, but they're not necessarily the people that do the work.
Yes.
So then they go and contract the people to do the work for pennies on a dollar. And when the money dries up, they also dry up because they're on to the next project.
Yeah.
Whereas that person and that partner that was doing the work, they're now left stuck.
Yeah.
But they're also left stuck with the mistrust that somebody says,
Oh,
hey,
all of
you
a
had
sudden
this,
it's,
you had this pop-up clinic and it was going great and you told me that it would last, but now you're going and I don't have a healthcare provider no more.
Right. Yeah.
So connecting the people that's getting the funding with people that are actually doing the work, or a person that can connect them to them that has that vested interest. They live, sleep, play here, so they're always going to come back and make sure this community is good.
Yeah.
And Seema, that's why some of the work that the collaboration that we did before that was so important, because it was about giving funding to people doing health equity work that are embedded in the community, but bringing us on as judges to vet these folks to make sure that are they really committed to the work? Are they part of the community? Because you can't just have
anybody,
outsiders come in and do the work, because then that perpetuates the distrust and mistrust.
Exactly, and because it has to be by the community, for the community, of the community, and that's where trust happens.
And one thing that Dr. Johnson said I think is so important is the funding piece. The funding piece, the mentoring piece, right? Because there are organizations that have been doing this work for years, right? And a lot of times they go unrecognized, right? But they don't have the funding, they don't have mentoring in terms of even applying for the funding, right? So it's not as accessible to them. And so those are the structural barriers that we talk about that are in place that prevent organizations that really deserve the resources.
Absolutely. So now it's like, so some of the work that you're doing, Uché, is like about taking this work that's happening in the community level, but then broadening it and opening the eyes and the lenses of big institutions. Because change needs to happen there and allyship needs to happen there, right? So how is that work going?
So that's interesting. Interesting that you asked. So the work that I do with advancing health equity, we essentially partner with different types of healthcare or public health related organizations. So it could be a startup, it could be an academic medical center, it could be a hospital system. But we started out doing mostly trainings, but obviously we all know that trainings are not effective if you don't do the other piece of the work. So we do program evaluations and organizational assessments around health equity and racial equity. And we also do leadership development and coaching because we appreciate that it's very important to take a holistic view of how organizations and institutions run. So down from your mission and vision, right, to how you're recruiting and retention, to even the physical environment of your organization, all of that plays a role into how included folks feel working there, and also the care that you're delivering to your patients. And so I would say that there is a selection bias in terms of the organizations that come to us. A lot of them want to do the work, and some it's obvious that is just a checkbox. So when we're vetting organizations, it used to be that we wouldn't really vet them so much, but now we vet them. We say who is doing the asking, like who wants this work to be done? Is there buy-in from leadership, right? Like what are the power dynamics within the organization? You know, like what?
Because you don't want to be, just checking you don't want people just to be checking the box.
And we talk about this is not like, for me, this work is very, very personal. Like I left a career to do this work, right? And so it cannot, and we know that it cannot be a checkbox to be sustainable. The other thing is really pointing out to organizations that it is a marathon and not a sprint, right? Like there's a lot of urgency that we get, especially after, the summer of 2020, like they want to do this work, but it's like, okay, do you really want to do this work? Because if you really want to do this work, you have to be in it for the long term.
Yes, it's not a one and done.
No,
it's not like
it can't be.
Flavor of the month, none of that stuff.
Absolutely.
Now, some of the work that you're doing right now, talk a little bit about that, about organ donation, and how you're bringing the community along, because that's a tough topic to handle in healthcare. Right?
Oh, absolutely. So we have our next barbershop talk is going to be focused on organ donation in the Black community. And it came about because we have one of our members out in Sacramento. So we partner with our Sacramento Black Nursing Chapter. And they said, let's make these talks more focused so that it can be broader. And we can see if these talks change folks' minds after they watch it. And he was like, I want to do organ donation. And then a good friend of mine, Josie, that's always been one of my partners, he said he used to work for organ donation. And the talk, when you go into a Black family room that is dying, and you even open and utter the words organ donation, they're kicking you out the room. You got to go. So we were like, well, let's talk about it. So then we came up with the idea. It was like, all right, we're going to talk about this in different segments. We're going to bring somebody who gave an organ before, black man who gave an organ. He also received the organ, right? Then we're going to bring one of my cousins who he was suffering from a real illness, and at one point we thought he was going to need an organ. So being in that moment of, oh wow, I need one. What am I going to do? And I don't believe in this. And then we're also going to do a segment with citizen scientists that we work with from a grant that talks about black lung health. And 2 of them has lost family members to lung cancer. So when we are talking about needing organ donation from seeing a family member need it. And then we're going to work on it. And that conversation has developed so much that, so one of the nurses is getting their DNP, Doctor of Nursing Practice. The other one's getting a PhD in nursing. They're both talking about making this the subject of their doctorate projects. And I told them, I was like, well, this is needed. Because in a PhD, you're going to do a bunch of research on it. And in your DNP, you're going to be implementing that, what you find from that research, so y'all can help each other.
Yeah, that's great. Uché, so in the 2 years or 3 years, shall we say, that you've been doing this, do you see progress?
I mean, I think by nature I'm an optimistic person. I definitely do see that current events, like things that happen in the popular culture, definitely spur organizations and companies to approach us. But I feel like, I'm not sure if the commitment is there, to be honest with you.
Yeah. Why?
Because I think, often when we think about inequities, we think about racism, it's those that are disproportionately impacted that are that feel it the most. And I don't think that should be the case. When you look at, for example, so the US, right, we spend the most on healthcare, and we have of any high income country, and we have the lowest life expectancy, right? And that is, even if you compare white Americans to Europeans, like overall, everyone in this country, the health is overall poor.
Yeah.
Compared to other high income countries. Everyone loses out. Everyone loses out when we have inequities.
Yes.
Right?
Yep.
So I think I definitely was hoping that after 2020, more people would be spurred on to wanting to commit to make a change. I'm not so convinced yet. I still have some hope.
Can I add
Yes,
to that?
hope. Yes.
So, because when we talk to organizations, one of the things I tell them, when you're dealing with systemic racism, you have to understand that systemic racist system cannot have one racist person in it and still produce racist outcomes. And when people don't understand that, that means that they're just part of a system, you're just a cog in the machine, and you're not personally doing anything. You're just following along, and then this happens. So getting people to understand that this is not an individual thing, because a lot of people become very uncomfortable when we say racism, they start saying, well, I'm not racist, right? And you see them sit up, and you see them, and then now you're fighting over something that was never the point. Because our point has always been, let's eliminate this systemically, right? Go ahead, I know you want to jump in.
No. I was just thinking, I think what I would love to see is healthcare organizations embed equity into everything that they do. And so what that is if you're creating a program, if you're creating a policy, you're thinking about who is going to be most impacted, positively or negatively. Are those the outcomes we want? Like, how are we going to measure success? Who is going to be held accountable? So more intentionality about operationalizing what equity looks like.
Yes, absolutely. And and at scale, right? Because
Right.
What you guys are doing is great, but how can we scale that and multiply that? And that's what it takes, right?
Right. And
At the systemic level.
Right, and so for example, for advancing health equity, when we work with organizations and we do a program evaluation or organizational assessment, we come to them with, this is our report, this is what we found in your organization. And a lot of times, it's not a surprise.
Yeah.
It's if they had listened to their, Black staff or other staff of color, it's all there.
Yeah.
Right? But you wanted to hire consultants to come in and do that. So we are affirming what what your staff have already said. Like, you already know this, right? And so the goal is to create organizations where everyone is being listened to, everyone's concerns are being listened to, and then integrated, right, into whatever decisions are being made, whichever policies are being made.
Yes,
everyone's
absolutely.
voices are being heard.
Absolutely. Now, I know that we can keep talking for a very long time, but I also want to make sure that our audience, I'm sure they're itching to ask questions. So I'm going to turn to the audience for a second and see. Okay, Aaron.
What are things concretely that, what are some concrete things that mainstream or non-minority members of the science and health communities can do to help advance equity and social justice?
So first I would say bring in the right experts, because sometimes when you're checking a box, you just go, here goes this company that's going to do it for me and I'm going to get it back. You want somebody that's going to give you the information that you need, like Dr. Uché is talking about. Then you also want somebody that can help you show you how to design it. And then you have to have buy-in once they show you how to design it. If not, all we did was have a very expensive conversation, right? And I know people want their money to go to good use. So get the creator, get somebody that can actually do the work, somebody that's on the front lines, have them design it for you, and then really buy into, stick into that design and implementing those changes into your organization.
I think for me, it's like kind of knowing what's going on locally for you or hyper locally in your community, right? Because a lot of these inequities are right next door to us, right? So, or even if you live in New York City, so for example, here the maternal mortality rate is 8 to 12 times that for Black pregnant people versus their white counterparts. Like that is horrible, right? So thinking about like knowing what is happening within your own community, educating yourself, talking to your family members, talking to your friends, like making them understand how practices and policies that actually exist today and that have existed in the past lead up to what happened today. How can you donate to Black-led organizations or organizations that are led by other people of color? Just sort of thinking about organizing, what organizing work is going on in your area. What community-based organizations can you help support or even get involved with, right? So I think that things are actually happening very close to you that people don't realize. So I would seek out what's happening in your own community.
Thank you. Other questions? Yes. Oh, there and there, yes.
Thank you so much for your conversation. I'm interested in hearing your thoughts on advancing equity for communities that don't have English as their first language. The reason I'm asking is that, so I'm originally from Puerto Rico. When the vaccines were rolled out, CVS and Walgreens played a really big role in the distribution. For like the first 6 months or so, they only had their web pages available in English. So from over here, I was booking appointments for my mom, uncles, aunts, friends of family, probably like over 50 appointments, and I'm not exaggerating. So that was really disappointing to see how even for one of the most widely spoken languages, those resources were just not there.
Yeah, no, I totally agree. I agree with you that shouldn't happen. And I think, I'm hoping that we learned from the last few years, but I think if there's ever like a pandemic response or disaster response, we need to make sure that we have all the communities at the table or representatives from those communities at the table, because we know that we all have blind spots, right? But in order to not have those blind spots, we need all different, perspectives and experiences present. So I think it shouldn't be an afterthought. It shouldn't be reactive. It should be proactive. And so that's why I always talk about, equity being embedded into sort of every program or decision. So for example, with the vaccine rollout, if they had had people from Spanish-speaking communities at the table, before CVS and Walgreens signed their contract, we would know that the website should be in Spanish, right? So thank you for bringing that up.
Absolutely. And it's important because you want to provide care to communities the way they want to receive care. Just giving you a small example on top of that, my daughter's half Puerto Rican. So her grandmother was diagnosed with diabetes, and she was in a hospital just very confused in terms of just feeling like people were talking at her and not with her. And I told her, I was like, just say yes. When you get home, I'll take care of you. So she gets home, I know she trusts me. So we worked about her care, but more importantly, what I told her was, I'm not gonna be the one to take care of you. I'm going to refer you to a colleague that's Spanish speaking. And she's like, wow. I was like, listen, he's going to tell you, I'll talk to you in English, I'll talk to you in Spanish, I'll talk to you in gibberish if you want, right? But I knew that she was going to have a different comfort level with them than with me. So being understanding of let them receive care they want to receive care, but also being competent enough that if they want to receive care from us, we can provide it up to the level that they expected.
Other questions?
So it's just something I wanted to share. I'm sorry. No, just about the whole trusted messenger piece.
Yeah.
No, I remember another story from a nurse who follows me on Twitter, and she said, I had a patient today who said he took the vaccine because he saw you talking about it on television.
Yes.
And that just, I almost started crying.
Yeah, what an impact.
Yeah, but that also, I think, we always say representation matters.
Yes.
And I think representation is one piece of it. It's important. There are other pieces that need to be fulfilled as well, but it is important, right? And I think that there was an opportunity, just like the amazing work that you've done with your organization, for healthcare professionals who look like us to step up in the pandemic and really talk to our communities.
Yes, absolutely. I mean, it's so important because, when you see someone who looks like you bring the message, just as human beings, it's so much more relatable than compared to somebody who, seems, not from the community. Questions? Quinta?
Thank you so much for this panel, because this is a very important discussion. And I, like you, Dr. Blackstock, would do anything for Seema Kumar. But I just wanted to ask you, I've run a biotech nonprofit in education for the past 12 years, and SEMA issued this charge maybe 5 years ago about having 50% participation of women at the bench, which was a really important call to action. So we developed a mentorship program due to SEMA's help to get women, to bridge the gap for women. So I just want to ask you, because representation is so important, how do we get corporations and life science organizations to care about pathway creation for Black and brown women or people of color in general?
Start.
No, I mean, I think having conversations like this today, but also, I know that there are programs that hold organizations and corporations sort of accountable, for, making these, promises,
yes.
right? That, they will have a certain percentage, but I think also it's emphasizing the importance of these pipeline programs. Like without pipeline programs, and I think these pipeline programs should start as early as possible, nursery school, pre-K, but I think that's only one piece of it. The other piece, obviously, is the mentoring piece, and then also the funding piece, because we know that there are disparities in terms of people, of generational wealth, right? Yep. And being able to afford it. But I think, having these kind of conversations, engaging with the leadership of these organizations, making them understand why it's so important. And it's also a long-term investment, right? Because the pipeline, those kids won't come out for quite a while, but it's understanding the importance of it.
Absolutely. Anything you want to add?
That was perfectly said. A lot of it is me, when it's women to women talking, I know as a man I'm supposed to sit down and be quiet. Only other thing I would add to that is that, two things. One, finding out where the women are so we can talk to them. Are they in churches and schools? Are they in hair salons? Are they in women health groups? Wherever they are, and then getting people like you up in front of them. Because you are a better pathway than most people are ever going to be. And talking about your work and the things that you do, because they see you and they see themselves, right? Or they see somebody that looks like them and they understand it better from that point. So getting you up in front of them, and not just you, because I do understand that for folks like you, Dr. Uché, myself, the work can get tiring. And we also have to do things like when Dr. Uché said she had to work at urgent care so that she can sustain a living while she was creating her dream, right? Because it gets tiring. So getting women like you and training others and putting them in front of them, and I think that creates a great pathway.
Thank you. Hi, how are you? Welcome.
Hi. I have a question for Dr. Johnson regarding organ donation. I understand, of course, that organ donation is a sensitive and difficult subject to talk about in general. And I also fully understand that various communities, including my own, I'm originally from India, and there are various sub-communities within India, and there are several topics that are taboo to talk about or extremely difficult or stigmatized in my community as well. So I do understand that different communities have different topics that they prefer avoiding. But I guess my question to you, Dr. Johnson, is please help us understand, or at least please help me understand, because I'm ignorant about this. Why is it that organ donation is a taboo subject among the Black community? Thank you.
Absolutely, and I think we can both speak to this. When you have a level of, and I dislike the word mistrust, because mistrust usually means you and I did something together and then you betrayed me, when it was really mostly just
You betrayed
the
me.
American system just betrayed
He betrayed me.
right? Like, we weren't even in business together, right? Like, you told us get on a boat and we ended up in America. So what happens is that you have that long history, and then you bring providers in that say, hey, your family member is dying, we want to use his heart for somebody else. And in your head, you're thinking two things. One, are you trying to kill him, right? Because they can legitimately say there has been experiments, just life instances where you came in under the portrayal of doing something good and we died or become very, very sick. So you're thinking about that. Then even if they want to say, okay, I'll do this, right? They also start asking, well, who is this going to benefit from? Right? Like, is it going to benefit somebody like me? And we know the healthcare system can't act like that. So you have to tell them, we honestly don't know. It goes to the next person. And then they start having more questions. All right, I don't trust you, but I'm going to give you an organ to save somebody that doesn't look like me. Then if I save somebody that doesn't look like me, they may grow up to do it again to my child. And you're just having all of these thoughts on top of their cultural beliefs, on top of many, go ahead.
No, go ahead.
No, because I also say it because as a nurse practitioner, I deal with it from one instance as a primary care provider and just preparing people before they enter this. But with Dr. Uché, she was in emergency medicine. She understands when they're actually having that conversation in the room.
Yeah, no, I totally agree with you. I think it is the issue of institutional mistrust. Like, and there are studies that show that, for example, communities that are heavily policed, where people have, there are a high degree of interactions with the police, that even those communities, people that live in those communities, so in the United States, disproportionately Black communities, have a distrust in medicine or towards healthcare institutions. So there is a lot of overlap in terms of trusting institutions, whether it's housing, whether it's policing, whether it's healthcare. So it all is interconnected. And just like Dr. Johnson said, people are wondering, can I trust that you are asking me for my organ for good reason? Are you actually going to do something, good with this? Are you trying to harm me? These I think are viable questions that people have.
And part of the way that we start to break down those barriers is taking ownership. And meaning, I know that as a Black man, I didn't do anything to that family in the room. I also know that I relate more to them than I do to my profession. But when I walk in the room as a healthcare provider, I take ownership of everything the healthcare system did to them, right?
That's true.
And I go, yo, listen, I know it hasn't been good for you. And I take ownership. And because I'm taking ownership of it, I'm trying to now build a bridge for us to get past it. And we don't have enough people that want to take ownership, because rightfully so, you're right, you didn't do anything, right? But I know I represent a lot of people. I get blamed for things that medical doctors do, right? And like, we always have a nice joke between nurse practitioners and medical doctors. I'm like, I'm not even one of y'all. Why am I getting blamed for it, right? Kind of like middle child syndrome.
Yeah.
But I understand that you take ownership of it. And that's how we start the process of healing.
And I was just going to add, we hear a lot about Tuskegee, but there's even something called the Mississippi appendectomy. I don't know if people have heard about that, but it's in the South in the 30s, 40s, and 50s. Women, usually poor women, usually women of color, would go into a hospital for a gynecologic procedure or maybe to have their appendix removed, and then have tubal ligations without their informed consent, so they're not be essentially sterilized. And so that was called the Mississippi appendectomy, and thousands of women had that done to them, where they didn't find out until they were older or trying to bear children that they were not able to, right? So I think we really need to understand the history a lot, and how the healthcare system and institution within this country has had a history of betraying people, and still we're seeing, we still see patterns of that. So for example, there's a study from 2016 that shows that medical students and residents, these were mock cases, but they show that they think that Black patients experience pain differently. They think that our skin is thicker, that it's not as sensitive to pain. Yeah, this is in PNAS, that's the name of the journal, and I always cite it in my presentations. But we're still dealing with people think that there are biological differences, and we talked about this earlier, because in textbooks people will say, oh, there's an increased risk of diabetes or high blood pressure, and the risk factor is Black. And we know that there are, race is a social construct. So if you're talking about geographic ancestry, that's one thing. But if you're talking about race, there's no biological basis for that, right? What we're talking about is the impact of racism, right, on the social determinants of health, which harm health. So it's sort of just really.
And there are so many factors that go into that,
right?
Yeah.
Yes.
Which is, it's just like if you peel the layers of the onion, then you really get down to.
So essentially asking everyone to peel the layers. Like, don't look at everything so superficially. There are reasons for everything that we see. Everything that we see in this country, there are reasons for it. There are practices and policies that have resulted in this.
Yes. I think we have time for just one last question. I saw. Okay. Oh, we have two questions. Bill, did you also have a question? No? Okay, go ahead. Cedric?
It's really funny, this conversation is really poignant for me, and it's priceless. And there's a reason why there is nothing that there's no value that I can place on this conversation, simply because I've been the victim of it several times, but even of late. My wife is Puerto Rican. We discovered she's losing her hearing. And so she went to the doctor, and it seems as if everything was ramrodded through, and she has a hearing aid. And I was left with the question, well, what's wrong with you? And my wife could not answer the question. And I said, well, let me see the paperwork. I'm looking at the paperwork, and there's no real prognosis, no real diagnosis. We don't know what's wrong with her. She's just losing her hearing, and she has a hearing aid. It isn't until a few months later when it gets even worse. And so now I said, you know what, let's take a step back. We're going to attack it on two fronts. We're going to go back to the PCP. We're going to actually have a discussion with the PCP and see what he's recommending. Because the PCP at the time was very busy, so she saw someone else, and this is how we got sidetracked. So I said, okay, let's go back to the drawing board. So we did this, and we attacked it on both fronts. And the doctor says, no, this is the wrong direction. This is what I'm going to do. And he recommended that we go to a doctor that he knows intimately. And so we went there, and suddenly there are tests that need to be done. And it's like, wait a minute, we know what this is. We know what's wrong with you. And as a matter of fact, you don't even have the right hearing aid. And that's when we did a little more digging and found out that her health insurance plan actually pays for a much better set of hearing aids. But she didn't get it. But when we checked the records, the original doctor was paid for it. But she got something completely different. And so now we're moving towards surgery to help correct a problem that is correctable. So my question would be, how does the individual access you?
You can answer that.
Shall I give him your phone? No, I'm just kidding.
Or organizations or people like you. What can we do to advocate? I mean, because my wife by trade is an advocate. So what can the individual who is not an advocate do?
So to your first point, right, which was how do we access you? Because that's a common question, especially when you leave practice, right? You still get your old patients saying, how do we get to you? And it's one of those things where we can't do both. we can't see people all the time one-on-one and do systemic change. It's unattainable because we'll fall down and die. So one of the things we try to do is, one, make sure we equip people with the weapons that they need. Because if you asked me that when that first happened, one of the first things I would have told you was, you need to get to a specialist that specializes in hearing loss and not a primary care provider. Because too many providers don't know how to say the words,
I don't know.
I don't know, right? And it's one of the most powerful things. I don't know, but I will try to find the answer. And they don't understand how much trust that creates. When that person can say, I really don't know, but we're gonna go look into it. And then I think for some of us, we're trying to create systems now where we can create organizations that you can have access to. That's not up and running yet, but for now, I would say trying to reach out to us however you can on certain platforms, and then we can try to push you in the right direction of people who are practicing.
Cool. I think you had a question,
young man.
right? Yeah.
So first of all, thank you for Ms. Seema for inviting me here and for supporting the biodiversity organization last year. And I had a question for Dr. Blackstock. What did you do to prepare for Harvard? Because I plan on going there one day.
Absolutely.
I studied a lot. No, I'm serious. I studied. Yes, I missed out on a lot of fun times by studying. No, I'm grateful I had the opportunity
Yes.
to go to Harvard undergrad and medical school, and so did my twin sister as well.
Yes.
Definitely in high school,
Yes.
we took like all the AP courses. We studied a lot. If I could do it again, maybe I'd do things differently. No, just because there's I think I define work hard. I think about how you define success. I think success now as a 45-year-old looks very different than what I thought success was at 18 years old, right? So think about what brings you joy, what brings you fulfillment. I think probably in retrospect, I probably would have really enjoyed a smaller college, like maybe a liberal arts college. But I could try that with when my kids get a little bit older. Yeah.
One of the most important sayings somebody will ever tell you: do what you have to do so you can do what you want to do, right? And I wish somebody told me that when I was much younger, because you could come back and have a lot of fun afterwards. Right?
Yeah,
You can start
it's
creating
true.
your fun,
Right,
you
right,
can start-
right now, work hard. Have fun later. Right? Yes.
Do what you have to do so you can do what you want to do.
Or balance, yeah.
Yeah.
You got a question?
Did you have, Bill, you want to, last question? Yes, yeah.
And this is a little bit of trust government in COVID. COVID created this acute experience that one doesn't see over lifetimes, 100 years, centuries. We saw it compressed in a very short period of time. We saw the disparity in the response. The most trusted voice, I can remember hearing this, and I have no reason not to suspect that he was a trusted voice, is Anthony Fauci, who led the science. We'll follow the science. And what I found over the last couple of weeks when the congressional hearings occurred, and there was testimony on the record, was this term government and science. I thought that was kind of a disturbing intersection, because follow the science isn't where government wants it to go, but where it needs to go to improve humanity. So now we're left at this talking point that comes after the hearings, where there's a lot of questions as to should we or do we trust this person? And if this person misled us for government-related reasons, is that going to affect the outcomes in a disparate health system already amplified by access, so that there will be even more reason to distrust? So it's kind of like, is it my imagination? Am I sensing that we're kind of going backwards here, and there's reason to distrust, or maybe is there just the message that's being amplified is from people with an axe to grind?
Okay.
I think
it's an important.
I think that's such an important question. In full transparent. So I'm also MSNBC medical contributor, so I go on air a lot and talk about the COVID response. And there are parts of it that I thought were well done. There are parts of it that I thought were not well done. I think ultimately what I saw from the overall response, and regardless of administration, is that it was very polarized, and it still is incredibly polarized. And I actually think that now there is probably a lower trust of government because of just how policies and practices were made. I think there's a lot of reparative work that needs to be done. I have concerns about what's going to happen if there's for the next pandemic. The fact that masks themselves were so politicized, right? Like, I mean, like you could look at party affiliation, and there was in terms of usage. I mean, it's like, are we really following the science? But it's because of the polarized nature of politics right now. But yeah, no, I agree. Government and science. I mean, I think you're right. Dr. Fauci was seen as someone that's really well respected. But my barber, when I talked to him, said, you know what, I think I'm supposed to trust him, but I really don't trust him. I trust you more. So again, that's the importance of having people from the community really being the ones to, be putting the messages out, I think is important.
Absolutely.
And just Dr. Johnson, you're going in and out of the community on a regular basis. That what I never want to hear about you being faced with is, see, I told you.
Right.
You shouldn't trust this.
Yeah.
So my thing is, so we talked about before healthcare providers saying, I don't know. The other thing that healthcare providers, politicians, leaders need to learn how to say is, I'm sorry, I made a mistake, right? And when you start your relationship with somebody and they know that if you're wrong, you're going to apologize. If they know that even when you're not wrong, you're apologizing for something that somebody else did, they're going to start trusting you. And if we started that way and we were able to come back and say, hey, we thought this way when COVID started. These 5 things was absolutely right. These 2 things we were wrong about. And we're saying that, we're admitting it, right? I feel like we would be much further and it wouldn't be as much damage. Because what ends up happening is that when you never say I was wrong, people look at the 10 things you did and they just gonna pick on the 2 things you did wrong and they're gonna polarize it. And what I often tell people, because I dealt with a lot of, oh, but this happened with the vaccine and this happened. And I told them, listen, the best lies are based on the truth. Right? Like, don't ever forget that. Like, the best lies have some facets of truth in it. So when you pick it apart, you actually go, yeah, that's right. Right? So I just feel like it needs to be more transparency. And also, we can't have all our eggs in a basket of just one person. Meaning, it couldn't just be Dr. Fauci is the voice of reasoning and that's who we should trust. Because we just did a whole, hour and a half talk about a lot of communities do not relate to Dr. Fauci to begin with. So it didn't take much for people to find that one lie that has some truth in it and then just spread it and make people turn away.
I also think there's this other point where, yes, definitely, having humility, but I think also saying science evolves and things change. And I think there was a messaging piece that was really missed. I think we were just watching things unfold so quickly. And I know that definitely, like within the CDC, like there were things that they weren't sure that the public could deal with. So they tried to, adjust the messaging according to that. It kind of a very paternalistic way. So I still think the messaging piece just, unfortunately wasn't what it should have been. And because of that, I think we have the mistrust and distrust that we have now.
Thank you. And the words will resonate. I don't know. I'm sorry. So thank you.
Thank you. Okay, we're going to take one last question because it's coming from a special person. Yes.
Hi, I have a question for Dr. Johnson. How did you handle becoming a minority when you arrived at college?
When I arrived at college? So I handled it poorly at first, meaning I just felt out of place and I felt like I wanted to leave. I had a couple of my friends that went to Norfolk State, which is a HBCU, and I was going to transfer there. And 2 things happened. One, my mother had a conversation with me and she said, you can leave this school for many things. The only thing you are not allowed to leave for is because you feel like you're not good enough, right? The second thing was 9/11 happened. And while 9/11 was tragic for a lot of people and a lot of us in this room, one of the things it forced me to do on college campus was to go find my people. Because it happened, we couldn't get in touch with nobody back home, and all of a sudden, I saw all of the black students. And although we were small, there was enough of us to say, this is my community. And sometimes it only takes a little bit amount of you to really go far and make change. And then I realized Binghamton do great things. They have student organizations, so I got involved. They got fraternities, so I pledged. You can get leadership positions, you can do a bunch of different things. And I was like, I'm going to fully immerse myself in a college experience, because if you don't, then you are wasting your time at college.
Good advice. Well, thank you all so much for a very engaging conversation. And the bar is still open, so we can have some wine and food and continue the conversation. And to you both, thank you so much.
Thank you.
We could talk all day long.
I know
I
we
mean,
could.
you both are so interesting. And I welcome you back to CURE, because we need to have, this conversation cannot end here, right? This is just the beginning, and we need to make change. So thank you both. Really
Thanks,
appreciate it.
everybody. Thank you, Seema.
Thank you. Excellent.
Thank you.
It was excellent.
Thank you. Oh, good. I'm glad you're happy.
Yes, it was excellent.
good.
Thank you.
Okay,
Thank
good.
you. It was great.
Thank you.
It's really great. Thank you for all the great work you guys do.
yeah,
I mean, it's like really
thank
so
you.
important, and it's nice. Oh, okay.